An interesting fact that is unique to this medication compared to the other antidepressants is that it has the potential to cause a false positive PCP result on a urine drug screen. So make sure to be mindful of this if you have to give a urine sample for whatever reason. Welcome back, Straight Talkers. Today I'm going to talk about the medication Effexor so that you can be better informed when deciding whether or not to start this medication. So Effexor was first approved for medical use in the United States in 1993. And by 2018, it was the 50th most commonly prescribed medication in the United States with more than 16 million prescriptions. So Venlafaxine is the generic name and Effexor is the brand name. So how does this medication work? Effexor is considered to be a serotonin norepinephrine reuptake inhibitor, or SNRI for short. And it works by increasing the amounts of serotonin and norepinephrine in certain parts of the brain. In adults, Effexor is FDA approved for the treatment of major depressive disorder, social anxiety disorder, generalized anxiety disorder, and panic disorder. It's not FDA approved for the use in kids. However, it's commonly used off-label to treat several other conditions, including post-traumatic stress disorder, premenstrual dysphoric disorder, symptoms of menopause, diabetic peripheral neuropathy, and fibromyalgia. Effexor comes in both tablets and capsules, and there's an immediate release version and an extended release version. And dosing for the immediate release formulation is generally between 25 milligrams 3 times per day to 125 milligrams 3 times per day, while dosing for the extended release formulation is typically between 75 to 225 milligrams once daily. And if I'm using this medication specifically in kids, I'll often start at an even lower dose to help reduce the risk of potential side effects. And my approach is always to start low and go slow. Once this medication is started, it usually takes a couple weeks before you start noticing a difference. And in many people, it can take a whole 1 to 2 months before it reaches its full effect at the prescribed dose. Now let's talk about potential side effects. But first, make sure you hit that subscribe button so that you can be the first to know when new content comes out. The common but usually more mild side effects of Effexor can include things such as excessive sweating, nausea, vomiting, constipation or diarrhea, decreased appetite, indigestion, fatigue or insomnia, dizziness, nervousness, tremor, blurred vision or sexual problems, including impotence or abnormal ejaculation. And a side effect that is more unique to Effexor when compared to other antidepressant medications is its potential to cause increases in blood pressure. And this is usually dose dependent, meaning that it's more likely to be seen in people who are on doses greater than 225 milligrams daily. And because of this potential, physicians will likely monitor your blood pressure on a regular basis when you're taking this medication. More serious but less commonly seen side effects could include things such as increased suicidal thoughts or actions in those under the age of 25 years old, serotonin syndrome, increased chances of bleeding, manic episodes, and seizures. So when deciding to come off of Effexor, please do not stop taking this medication without talking to your physician first. And unfortunately, this medication is notorious for having pretty rough withdrawal symptoms if you try to discontinue the medication too quickly. And really, my approach when working with patients is to always gradually reduce the dose rather than abruptly stopping it. A unique discontinuation symptom that patients tell me about with this medication is electric shock-like sensations that go through their bodies, or some people will also call these brain zaps. Other symptoms can include dizziness, insomnia, nausea, or nervousness.